Let's learn how to make elemental stents in 3 simple steps. Now feel free to practice along with this video. You've got the free sample in the starter kit, and there's no need to worry about running out of time because you can always reheat the material. Step 1 is all about making a disc so that it's easier to apply the material to the pallet. During step 2, we're going to shape the stent directly on the pallet and try to get a very tight palatal adaptation. And then in the 3rd step, we're trimming the stent and checking the fit. Now, before we get going with those steps, a couple of things to look out for. First of all, if we don't get tight palatal adaptation, the bleeding won't stop. So, especially when you're placing the disc and shaping the stent, try to pay close attention to getting the stent tightly adapted to the palate so that the bleeding can stop. Secondly, really important to make the stent before anesthesia. If we don't do so, the stent won't be able to stay in place after the swelling is gone. And then the last 2 things have to do with the shape and the size of the stent. Make sure your stent is long enough to cover the entire graft and that it's wide enough so that we can press the material into the buccal sites for retention. So, step 1. Shaping the material into a disc so that we can apply it to the palate. With the water bath up and running, steam evaporating, we're going to wear gloves and apply some Vaseline. And then immediately after that, we're going to be pouring 1 sheet, so all 4 cubes of perioplast into the water bath. And then we're going to stir 5 to 10 seconds. We'll see the granules clitting together. And then we can take off the material off the forceps, just like this, and we'll start pressing it into a disc. As we're shaping the disc, we're pressing, not pulling the material. We don't want to feel individual granules anymore, and we're really aiming to make a stent that's 2.5 inches in width and 1.6 inches in length, and a uniform thickness of 0.1 inches. Then we're going to apply the disc to the palate of the patient. We recommend by doing that by sitting behind the patient and then supporting the disc with 2 hands. We're aiming to bring the disc, the front end of the stent towards the premolar and the back end of the stent towards the second molar, and then we're wrapping the material around the buccal side and firmly pressing onto the palate. And that's step 1, making a disc and applying it to the palate. So step 2, shaping the stent directly on the palate to get tight palatal adaptation. The first thing we do is press tightly with our index fingers onto the palatal surface and then wrap around with our fingers to press the excess material into the buccal side for retention, and then pay close attention to the palatal adaptation, and then we ask the patient to bite down, and while the patient bites down we can continue to press the material into the buccal side for retention. We ask the patient to do this for about 30 seconds, and after 30 seconds we ask the patient to open up again and then firmly press onto the palate again to almost press out air bubbles between a surface. So we ask the patient to open again. We're pressing firmly onto the palate, and then the patient bites again. The firmer the patient bites, the thinner the stent will be, the more comfortable it will be for them. And then after about 1.5 minutes, the stent should have set. And that's step 2, shaping the stent to get tight palatal adaptation. We know we're ready to go to the final step by checking if the material has completely set. We can do that by pressing our fingertips into material to see if we can still make a dent. That's not the case now, so we can remove the stent. We do that by supporting both sides at the same time, and we're going to check whether there's any excess material we would like to trim. Usually you want to check if there's any material on the buccal side covering the alveolar mucosa or any material covering the soft palate. Trimming is really straightforward. You can use a normal pair of surgical scissors. When you're cutting, make sure that you check for sharp edges and smoothen them out, for example by heating an instrument and then rubbing it over the material to smoothen those sharp edges out. The very final step then is to check with the patient whether the stent fits. We want to make sure the patient knows how to remove and place the stent themselves. So in this case, we'll also ask the patient to place the stent, and we, for one last time, check if there's tight palatal adaptation. We check with the patient whether the stent is comfortable, and there we actually made our first stent. So with that, you've made your first elemental stent. I now recommend we continue the process and just see how everything comes together by checking out the surgical protocol, recommended patient instructions, etc. Thanks for watching.